Hi, my name is Dr. Anam. I am working as a registrar in psychiatry mental health services, and I'm also additional joint secretary for Association of Irish Pakistani Physicians and Surgeons. Today, we are doing this recorded podcast for basic specialty training for medicine. And I have two of my lovely guests. Along with that, I have my lovely co-host, who is Dr. Mariam Zulfkar, working as a non-consultant hospital doctor in Cork University Hospital in obstetrics and gynecology. So over to you, Dr. Mariam, for introduction of our guests.
Thank you so much, Anam, for my introduction. So we know that we are having our amazing guest today, and we are having our podcast on basic specialist training in general medicine today. So we are having two of the honorable guests with us, Dr. Farkhanda Kaisar and Dr. Syed Sharjeel Shah. Both of them are year 2 BST. So I would like first Dr. Farkhanda to introduce herself.
Thank you so much, Dr. Mariam and Dr. Anam, for the kind words. My name is Farkhanda Kaisar. I am currently doing BST training in Tala University Hospital. My BST started back in 2021, actually. So yeah, exactly. So it's been 3 years. It's actually a very long process because I took 2 years of maternity leave in between. और मेरी BST अभी तक चल रही है. And it's a long process, but I think I'm finally getting there. I would love to share my experience with you of how the application process went for me, the interview, and how to make yourself a competitive doctor in order to be applied for HST. So that's what basically I'm going to focus on, and I hope that you can learn from our experience, from the mistakes that we made and we learned, and we hope that you can avoid those mistakes and become better physicians.
Okay, thank you so much, Dr. Farkhanda, for your introduction. And now over to Anam for the rest of the introduction by our second guest.
Okay, our second guest, as you have already mentioned, Dr. Sharjeel Shah, who is working as BSc Year 2 in Mercy University Hospital. So I would request him to introduce himself and his journey for being an immigrant doctor and also for choosing medicine as his specialty.
Perfect. Thank you so much, guys, for having me over in this podcast. And I will try to keep my background brief. Don't want to bore the audience. I know they're looking for the BST training and on the counseling stuff. So as you said, in BST, I started my BST second year in this July. I first moved to Ireland back in 2022, where I was doing emergency medicine. I thought that's my primary focus, but I felt like my inclination is more towards the medical specialties. So I opted for the BST program at that time around, which was very soon, the first few months in Ireland. And I was told, as many of you guys can also recall, that based on stamp 1, you don't really have a great chance of securing a spot. And stamp 1, stamp 4, all these stamps and the nationalities, so they all play a role. Anyways, I tried my luck, and luckily I got the spot in the very first year. And so I started my BST last year in July, and I've rotated through different hospitals, and so far it's going good. And I'd say it's an exciting journey so far.
That's very, very brief and very nice. Actually, thanks for mentioning about the stamp thing. Usually the people, especially the immigrant doctors coming from Pakistan or any other countries, have this kind of concept. But Association of Irish Pakistani Physicians and Surgeons have paved the role in terms of that, so that we can get the training schemes easily. I myself got training 3 months after I joined my non-consultant hospital doctor job in Ireland. So it's not necessary that you have stamp 4, only then you can get the BST. On stamp 1, we all have got, thankfully, and we will be helping through these podcasts to our juniors and all the other doctors who will be coming, so that they can have the practical guidance and they can have the knowledge how to apply, and they can try that.
Exactly.
Okay.
I agree, Doctor. And I'm like that's the purpose of this podcast. The reason I mentioned the stamps, I can go into more detail later on as this podcast goes on. The reason I mentioned is like whenever as you said, that we are the immigrants here in this country, when we come to their system, we feel like we don't have enough chances, which is to an extent true. But if you go through the system, all the prerequisites, all the criterias, you'll find there's always a way, but you have to stick with it, and you have persistence is the key, and eventually you get there. And
I agree. I agree, Dr. Shajil. The same thing happened with me. You know, when I came to Ireland, so I've been
yeah,
here now 5 years. So when I came 5 years ago, and I had started my first job, and I applied for BST
yeah,
just 2 months after my first job.
same, yeah,
And I
yeah,
got in. And at that
Yeah.
time, it was unheard of. Like now, a lot more people are getting BST, but when I got into BST, it was very rare for IMGs to get into BST. But like I'll explain in my talk as well. We just have to do what they're expecting. If we complete their requirements, they can't stop us from getting in.
yeah,
So
Exactly.
we just have to be good enough.
yeah, yeah, yeah. It's very transparent, very transparent.
Yeah, very transparent. I agree.
Perfect. Thank you so much for both of you for these kind of words, and for getting this kind of giving this kind of information as well, because I think it's the hope and it's the right information that we have to provide to our juniors and our colleagues. So, Dr. Shajil, what is the application process and what is the application period? When are the BST application for medicine opens? What is the process? So, can you please give us information about that?
Sure thing. So for the year 2024, uh, the applications, they would open on 7th of October. So it is only 10 days, nearly 10 days from now. So they will open on 7th of October, and the applications close by 14th of November. So these are important dates for whoever is watching this podcast. Now, once you have these dates, you need to know what you should have in between that period. Number one is IMC registration, as we are sure they would have that. Again, they would be asked for the English language proficiency evidence, could be OET, could be IELTS, whatever they have. Now, there's one more thing which is very important, and I really want to highlight this, that is appraisal forms. The reason I'm saying that is you need to have two appraisal forms, one from the current employer, one from the recent employer. So the current employer would be that particular workplace where you're working at the moment. You request one of your consultants and mentors to get that appraisal form for you. So it should be current one. And
Okay.
then a recent one could be 6 months back. If you're working in a different hospital, you can request one of your consultants or mentor. They can get that appraisal form for you. Now, there's another thing to it. That is, you can't simply take pictures or scan it and send it. They won't accept it. And I'm building up the whole story because I'll in the end I'll tell you an example where so you'll understand why it's important. So, anyways, now this is important. Next step is, I would say, at the moment I did check, but it's not available. It would be available on 7th of October. Otherwise, I would have gone through and I would have added more details to it. What I would say is go through that appraisal form prerequisites at least twice, if not thrice. Okay. The reason is the formatting of that appraisal form is very important. I know few of my colleagues who are very good, had like in terms of qualifications and all that bits, they had excellent application, but their application in the end was rejected just because their appraisal forms were not exactly as requested by the RCPI. So imagine like you're doing everything right and you just mess up your appraisal form, your whole application process gets null and void, and you miss out. And so that's one reason I'm saying again and again, appraisal forms are very important. So you need to make sure. Then once you start the application, it's, to be honest, it's got very easy interface. You'll understand everything is mentioned very clearly on the application. It's an online application. You can save it and you can continue editing the application. But once it's submitted, then it is submitted. You can't get back, So that's another thing I really wanted to mention about that application process. And then in terms of documentation, You'd require professional qualifications. It could be any diploma you've done. It could be membership exams. It could be a master's degree, anything. You can add all of that in your professional qualifications. That would be part of your online application. Then comes your audit experiences. If you've done any audit, make sure you're attaching the evidence of that audit because they need evidence. You can't simply write about that I have done this, 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 and this. Then comes your publications. So in terms of publications, you can divide them into two subsets in a way. There are ones which are published in a local journal. So you get awarded 2 marks if you're the primary author, and if you're a secondary author, you get 1 mark for that publication. But if your publication is published in an international journal, then you get 3 marks for the same publication as a primary author and 2 for the secondary author. So in addition to that, you can also submit your abstracts, case studies, poster competitions if you participate. Even if you participated, mention it, add all those certs in your application. But in the end of the application, you'll have a complete tab where you can upload all of that. The reason I'm saying that, all this would make a lot of impact when it comes to your interview. You'll get you'll get the scores for your publications, for your case studies, and that would add up because in the end they would be scoring you out of 100, and in that 100 everything counts in your professional qualifications, these publications, and everything. And then if you don't get, like, for instance, you didn't win any poster competition, you participated in that, you participated in a conference, right? You might not get marks for it, but it kind of creates good impact on the professors and consultants who are conducting the interview. So they'll think that this candidate has shown enough interest in the field of medicine, is willing to participate, is willing to go to conferences, willing to participate in the poster competition. So in the end, like, everything adds up. So that's mainly about it.
Perfect. And can I ask you that lot of the people who are coming from back home or any other different countries, so does the past experience matters as well? Is there any requirement that you have minimum of this kind of past experience after in medicine or in any kind of subspecialty? Does this thing also impacts?
I would personally say no. The reason I say that, I started in emergency medicine, so ED, that wasn't general medicine, number one in Ireland, and my application was only in 3rd month. So in that sense, there's no Irish experience. And before that, I was working in a peripheral hospital, which is better known as THQ back home in Punjab. So like you know, like, what kind of peripheral hospital we have back home. So if this was some major issue, I wouldn't have got the spot, I would say.
Yeah.
So in essence, I would say no, it doesn't really matter. What really matters is what they require, and they require a proper application, proper appraisal forms, proper experiences recorded, all your qualifications there, and these additional stuff which decorates your CV, these publications, these audits, and all of that. So I think these are the real ones. So you don't get disheartened that you don't have enough Irish experience or good Pakistani tertiary university hospital experience. I'm coming from a THQ hospital in Punjab, and we all know better how THQs are back home.
Yeah. Thank you so much.
I just want to add one point to that. So, when you were talking about the BST appraisal, I also wanted to mention, like I said, when I applied for BST, I had only worked 2 months in Ireland, but thankfully I got really good references from those 2 months as well. So I got 2 references from Ireland and I got 2 BST appraisals from Pakistan. So, you can even do that. If you feel like, you have somebody who can give you a good reference in Pakistan, even they can fill the BST appraisal forms. But the only problem is, our Pakistani professors, you would have to tell them how to fill,
So I was doing the appraisal forms. It was like that you have to send the appraisal form to your consultant, and the consultant has to sign the appraisal form for you, and they have to send it directly to the deanery or to the college. What was it for the Royal College of Physicians of Ireland? Was it like that? The consultant has to send it back to the college by themselves, or did you get it signed from the consultant and you have to send it?
So I think back then it was slightly different as compared to what they are proposing these days. That's why I mentioned that I haven't gone through the appraisal form. It's still not there on the website. And that's why I was mentioning that needs to be checked, because they have mentioned that it can't be uploaded and, directly sent by the candidate himself. So in my time, I would say it was one of those letters which was, of course, done by the consultant and then sent directly to the Royal College of Physicians. And it was the same for the consultant back home, because one of my appraisals was requested to my previous employer back in Pakistan. So the professor, she did the same, and I requested her for that, and she was very kind, and she sent it with the DHL service. So it's like that for us as well.
Perfect. Thank you for that.
And now I am going to ask Dr. Farkhanda about guidance regarding interview of basic specialist training. So I would like to ask you, like, what do you know about the panel thing, and what do you think how the candidate should introduce himself or herself who is going to appear in BST interview?
Sure. I have actually made a little presentation because there were a few things that I wanted to share. So I'll see if I can share my screen. So here is my screen. Can everyone see the screen?
Yes.
Yeah, we can see
Yes.
that.
Okay. So before I move on to the interview, I just went through my emails and I was trying to figure out when each step of the application happened. So like I said, I applied a very long time ago, and my BST application was submitted in November 2020, and I got the interview offer about 2 months later. And then I had the interview about 2 weeks after the offer. So that means, once you have the offer, you have some time to prepare for the interview as well. And then the interview results came back pretty quickly within about 2 weeks again. And once the interview results are out, everything happens very quickly. The round one selection offers within the next few days. Then the round two is, after a few days, round three, round four. I heard, there were even people who got BST up to round 5. So, there are a lot of rounds. I was fortunate enough that I got the offer in round 2, and I got from Mayo and Sligo. And I was then allocated the hub around April. So my initial allocation was Sligo. However, because like I said, I was on maternity leave at the time, so I didn't join Sligo at that time. And my family is based in Dublin, so I had requested our CPI to, give me another allocation in the next year BST, and that's what they did, and that's how I landed in Dublin then. And I just wanted to mention a few more things about the application. This is what Dr. Sharjeel was telling. This is a very important table. It's present on the RCPI website. So for those of you who have some research experience and they're wondering, okay, well, how much marks will this carry? If I have a published article as a first author, how many marks? If it is an international journal or national journal, if it's a case report, or if it's a poster presentation, oral presentation. So all of these, this is all present on our RCPI website. So when you're applying for the BST application, I would strongly suggest that you go through this website in great detail. Read through every there are frequently asked questions. There are different, points over there. Just go through everything, while you're preparing the application, so you know what you're actually doing. And then this is the interview. So the BST interview, once you've submitted the application and you've been shortlisted for the interview, for me, the interview was an online interview. I don't know if that's what they're still doing. So my interview was on Zoom, and I don't remember exactly how many people there were conducting the interview. I think there were maybe 2 people. So the first question, so by this point, when I'd applied for BST, before that, I had appeared in a lot of interviews, job interviews, standalone job interviews. I think around maybe 8 or 10 job interviews before I appeared for BST interview. So that was really good, you can say, experience for me. And good practice as well before the BST interview as well. So that is something that could help other people as well. If you're still looking for standalone jobs, try to apply everywhere. And if you're shortlisted, even if you don't mean to go there, just attend the interview for the sake of experience. But obviously, don't do this, that you accept the offer and then don't go there. That's obviously not a good thing. But, if you're appearing for the interview, that is a good experience in itself. Every interview that I have appeared for so far, whether it was a standalone job or a BST, the first question they ask for is, tell us about yourself. So that is a mandatory question that everyone is going to ask you. So for this, I would suggest that you prepare a short, introduction about your own self. It could be 1 to 2 minutes maximum. And whether, at the same time that it is well rehearsed, but it shouldn't seem like you were saying it out of memory. So it's not something like, da 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 da. No, you have to do it properly. For example, if, when I was introducing myself, I would say, okay, this is my name. I am a graduate of this university. I graduated in this year. I did my intern year. I went on to gain some clinical experience. So, there's the CAMP acronym. So, how I got this acronym was I attended an interview skills workshop. So, those workshops are helpful. So they give this CAMP interview acronym, and I found this really helpful. That's how you can make your introduction. So first you tell about your clinical background, clinically, I worked in so-and-so departments. I have this many years of experience in medicine or whatever, Then my academic background. Academic background is, for example, I have, so-and-so publications, or I've presented posters, I've done audits, I've done case reports, or whatever you've done in on the academic part, Third, you talk about your management experience. So, for example, over here, there is the NCHD committees. So if you're in the hospital, make sure to become part of the NCHD committees. That counts as management experience, and that's official management experience. So you can't just be like, oh, I did this, and you have no proof for that, So whatever you say, you need to have proof for that. For example, when I was in Pakistan, over there, we used to have rota in charges and batch in charges. So I was involved in those things. And I got a letter made from my hospital as well to say that I was doing all those things. So, management experience. Then you talk more about your personal aspect. For example, you can be like, just to put a personal tinge, your hobbies, 1 or 2 things. I like cycling, or I like swimming, or whatever, just 1 or 2 things at the end. And they would just make the interview environment a bit lighter. They might joke about something, they might, and you're setting the tone of the interview in these first 1 or 2 minutes. I remember when I was appearing for my BST interview, around 1 or 2 weeks later, I also appeared for my GP interview, because I'd also applied for GP training at that time. And the first question they asked me was, oh, isn't this a lovely weather today? And, and that's how they started the tone of the interview. And so we started talking about the weather for like a few seconds. So, just try to be, well prepared for the interview, but don't sound like you have rehearsed or you've learned that introduction. I don't know if that's possible, if you understand what I'm trying to say,
But it should come as a natural. It should come as a
something
natural thing.
naturally.
But at the same time, you have managed your points,
Exactly.
what to say and how to say that. Yeah.
Exactly. So, 1 to 2 minutes introduction, highlighting your strengths, try not to mention your weaknesses in the very first 2 minutes, highlighting your strengths, telling them why they should choose you, for the BST, why you're a good candidate, what is the experience you've done so far, and what is it that you're looking to do in the future as well, For example, I remember at that time, I had done MRCP UK, but I hadn't done MRCPI at that time. So I said, I've done the MRCP UK exams, and I'm hoping to do my MRCPI exams after, So you can say, this is what I've done in the past, this is what I plan to do in the future. So that's, there are different ways of how you can introduce yourself. So that's the first thing. Then secondly would be a clinical scenario. So the clinical scenario, it won't be something straightforward. They won't say, oh, tell us the approach to headache. They're not going to do that. They would have a huge scenario on the screen in front of you, saying this, the way we get clinical scenarios and exam questions. Explaining that this is a man who came to the ED, had this complaint, this was his examination, this was his investigation, and so on and so forth. What is your next step? and then you start telling, with history, you start with history, this is what I would ask in history, this is what I would, examine, and this is what my suspicion is, and all that. So for a clinical scenario, I believe for myself, what really helped was the fact that I was preparing for MRCP UK Part 2 at that time. So I was really well rehearsed at, looking at a scenario and making a diagnosis in my head straight away. Because, you get into that pattern when you are preparing for an exam. So that's what really helped me. But on top of that, I also prepared for the interview. So what I did was I used the Oxford Handbook of Medicine, and I used the website wicm.org, which is on the screen in front of you. The Oxford Handbook of Medicine for common emergencies, like upper GI bleed, headache, stroke, all of those things. And Wickham it tells more details about the dosage of drugs. This is more like an emergency medicine guide. Dr. Shurjil might be familiar with it. I don't know, but this is something that was shared to me by my friends who are working in the US. So they use this a lot. And I found that this really helped me, because this tells you exactly what needs to be done when you see a patient, in terms of steps, like step 1 is this, step 2 is this, step 3 is this. So I really found this website helpful. And I also then drafted an overview of, management of some of the common diseases. I went onto this website, patient.info. The common diseases, we all know what the common ones are, clinical scenario wise. The people we see with COPD, CLD, CKD, CVA, stroke, headache, any of those. So, and then different presentations of those diseases. So you need to know the management of those. You could get any of those in your scenarios, So the way to go forward is, they're not looking for a consultant at this point. They're this is an entry training program, So what they want to know is your approach. How would you approach a patient? What is it that you would be looking for? What is it that you would be doing? So you have to, frame your answers in that way, that you're telling all the steps, that you're a safe doctor, and wherever you feel that, oh, you don't know, what will you do? You will speak to the senior, So that's an important thing. You have to know your limits. You have to know that this is what you will be recruited as an SHO when you go when you get BST, So you have to know your limits. You have to know, okay, this is all I know, and once I don't know anything, I'll speak to the reg or I'll speak to the consultant. These are the sort of things they're actually looking for. They don't want you to tell the management of a complicated disease and all the difficult names of drugs or whatever. That's not what they're looking for. So that's a clinical scenario. And thankfully, it went really well for me. And I literally, like, when I think back to it, I think I literally flew through this one, because with all the experience, with all the exams, these things become just second nature to you. The last 2 questions, they're the ones that are difficult for people like us who haven't worked in this system, teamwork. So they will ask you a question. It could be anything, relating to a difficult colleague at work. How will you deal with him? So the way to answer that is there's another acronym to it: situation, task, action, and result. So they will give you the situation, you have to say, okay, this is what I need to do, and this is how I will do it, and this is what will happen afterwards. It's a bit difficult to explain this way, but you have to use your common sense here, and you also have to remember the work ethics of this country. How would you respond to situations like these? If it's a difficult colleague, you will speak to him first. You will try to understand what's going on. You'll give him one chance. You'll speak again. You'll give him another chance. If it's still not working out, you'll speak to the consultant next. That's the way of generally framing your answer. The last, ethics, that is the most difficult one, I think, for international medical graduates, especially for Pakistanis, because I think we did not learn much ethics in a proper documented way back home, unfortunately. So that is something, we would need to prepare on. There are a few resources on this. However, when I was preparing for my interview, at that point, I felt I did not have enough resources for ethics. Like, this was still a weak point for me. I don't know if Dr. Sharjeel has anything to add on this. I myself, I think I would appreciate, like, now, obviously, now that I've worked in the system for so many years, like, these things, I know them. But I don't know if there's a book or if there is an information leaflet or anything, any resources for, answering these type of questions. Like, if you're aware, any of you, if you're aware of those, you could share with our viewers. For me, I've just learned with trial and error. I've just learned, by working in the system, what to do, what not to do.
Yeah.
I agree with you. I agree with you. It's quite difficult actually for people like us coming from Pakistan and the ethics and the way they are dealing with stuff here. So for me, again, yes, I kind of struggled. But then, as I told you earlier, I was in ED, so I would come across somebody who would be in with alcohol intoxication or alcohol withdrawal, or somebody who's a psych patient and who's getting aggressive. So as an ED physician, you'll come across these patients every day, like every day. So I kind of got a lot of help from that, and then also my consultants, they were very nice to me when I was preparing for the interview. So I spoke to them. They kind of told me these questions as well. Somebody who wants to sign leave against the medical advice, and how to assess capacity, what you need to see, what you need, what you can ignore, what you can't ignore. So all those things. So my personal resource was, again, these experiences and the consultants. I couldn't really, to be honest, get something on ethics, but I would say, even if you simply search, give a random search on Google, and based on the ethics, medical ethics, you'll get so much stuff. And there's one more thing which you can do is, there was a recently, I think a couple of months back, Irish Medical Council, they released a proper document which has mentioned a lot of stuff based on all these requirements, as an NCHD, as a senior registrar. So that booklet is very, very, I think, handy. And if that can be searched on Irish Medical Council, definitely that's a good read. You don't need to go through all of that booklet. You just go through the index and you can find the ethics section and communication section. And I think that can also help you out. So it's more about getting stuff from all around and working it together. And that would surely help for you guys.
That's very helpful.
Agree.
And I will also add one more thing. We do have, I think it's mandatory for us, for the psychiatry trainees to do, and all the people who work in psychiatry to do. There's a mandate, like not mandatory for everybody, but for the viewers who are watching this, obviously for the ethical questions, you can do this. There's a website called HACland. .ie, and it's free. All the courses available over there are free, and there's a short course available for ethics and law for the professionals working in Ireland. And most of the scenarios and most of the information that is present in that topic, it's, I think, 30 minutes presentation, and at the end there is a quiz. So it tells you everything that you are supposed to do and you are supposed to ask in the interviews. So
yeah, that's a very good suggestion.
That's a very good suggestion. I agree. So, so I want to wrap up now quickly. So this is the GIM interview scoring guideline for this year. And this is how your application will be scored and how your interview will be scored. And at the end, you'll be given the total marks and a rank. And according to that, you'll be given, BST. So academic achievements, I think the biggest hurdle for us is that, where they say undergraduate academic achievement, they're looking for a centile and decile letter. The graduates here, they're ranked according to their marks in, undergraduate school. And they can get maximum 18 or 16 or 14. They can get all those marks. For us, because we don't have centile decile in our universities, so the max we can get, even if we provide them a letter, is 6. So for us, this was the biggest hurdle. It's the biggest drawback we could have, but there are all the other marks. So we still have 80 marks we can compete with, you know. The other marks are research and other qualifications, 13 marks. Like I said, you know, I explained before how each of the contributions in research would get you different marks. Professional development. So, you know, Dr. Sharjeel, you were talking about the experience. So this is where your clinical experience marks would come. If you've had any clinical experience, you know, doesn't matter which specialty, but any clinical experience, if you've done any exams, you know, membership exams, any diplomas, anything like that, they would come, you know, the marks for that will come in this professional development. So, you know, anything you do is not useless. You will get some marks somewhere. It depends on how they do the grading, but I think they will give you some marks.
I agree. I agree. I thought that the question was whether your past experience, hospital experience, would count in factor in a lot or not. Because I've come across people who get disheartened by the fact that they haven't worked in a very good hospital, you know, in a university hospital and all of that. So what I was trying to refer earlier was that this doesn't really make a huge impact. Of course, these researches and everything like this is counted. That's the reason they're, you know, explaining all of that. As a primary author, you get this mark. As a secondary author, you get this mark. But it's just that I wanted to motivate everyone around, like, it doesn't really matter that if you haven't worked in a university hospital or, you know, very famous hospital, you still have to go through, still have to try, and you'll definitely score.
Yeah, like professional development, they will give you marks for training, like for any experience. I mean, for any experience, doesn't matter whether you worked in a tertiary care or you worked in a THQ or whatever, it's still experience, you know? So I think that's how they would mark that. And then clinical acumen, so the interview, so you'll get 2 clinical scenarios. So for the clinical scenarios and how you dealt with them, 17 marks each. Then overall interview performance and communication skills will get 26 marks, and then a total of 100 marks. The next slide, I just wanted to show, because I want to motivate you guys that do not be disheartened that, you know, we're not getting any marks, and we're not getting many marks in undergraduate, and how are we ever going to, you know, secure a BST? So this was actually my own interview score. So the reason I wanted to show was, so you look at the academic achievements, that's just 6 out of 20. For research, so in my time, the scoring was a bit different. So research had 10 marks at that time, whereas now they've increased that to 13. So I scored some over there because I had some poster publications. I had some publications as well, but they were like in local Pakistani journals. They weren't like high, very like international journals or anything, but I think they still got me like one mark or something on that. And then I think I had some oral presentations. So I had like very, like, you could say basic stuff that I did when I was in Pakistan. But, you know, I still got the marks. So, you know, the point is they're not looking for high quality research. They're just looking for any research that you did, you know, any audit, any, you know, presentation that you did in a research conference. So, you know, they would get you the marks. And then professional development, I think I got full marks in that because, you know, I had the MRCP UK exams, I had the membership exams. I had done 2.5 years of training in Pakistan. So I was doing FCPS neurology. I left it halfway there. So, you know, I had, you know, 3 or 4 years of clinical experience. I had membership exams. I think, you know, that's what they were looking for. This person is trying to, you know, achieve something. Clinical acumen, so like I said, I flew through it seriously. I don't think it's like a huge credit to me. It was just the fact that the interview came at a good time when I was preparing for my exams. So
Yeah.
I think I just got lucky in that. So clinical acumen, I got 29, and interview performance and communication skills, like I was shocked myself. I got full marks in that. So total score was 68, and that's considering the fact that, you know, I lost like 10 or 12 marks in the undergraduates. And I remember, you know, I was comparing my score with some of the interns that I was working with. And that intern in the undergraduate, she had like a very good score. Like her score was like 16 or something. And yet her total score was just 50. So, you know, we can catch up. That's what I'm trying to say. So if we're lacking in one, you know, we just have to make up in the other categories, you know. So, and the rank as well, like I got a pretty good rank, but even despite this good rank, I did not get an offer in round one, and the intern who had a score of 50 got an offer in round one. So that is because, she was Irish. So that's also a major setback for us, that we're not Irish, But now, because of the efforts that apps have made, if we are stamp 4 holder, we'll get the same preference as with EU members. So, that's like a huge achievement.
Yeah.
And it's like we're not way down the preference list as we were before. So, there is still a huge chance for us to get into BSD and even into HSD. I'll be speaking about that later. We just have to, do all, fulfill all the requirements. And once we've done that, we can, get BSD or HSD and become consultants. So like the bottom line is, we need to be prepared for this interview. Do not take this lightly. What the major categories of the interview are. Prepare each step and go with full confidence, do your best, and then leave the rest to Allah. That's what I would say.
I think they are looking for determined and well-prepared doctors. They're not looking for the perfect doctors,
No,
because
not at all.
it is
Yeah.
the journey of the BST which will
Yeah.
make you a good and a perfect and a responsible doctor. But they want to see motivation, determination, and a hardworking person in you.
Yeah,
And you have to
exactly.
portray that in your application and in everything.
They want
Thanks,
groomable
Dr.
doctors who can be groomed. Exactly. This is what they keep saying. Like even the consultants,
Yeah.
even those who conducted interviews, groomable doctors, they can groom. Safety is first. Like
Safety,
Yeah.
Exactly.
Safety is
Exactly. Very good advice.
Yeah. So moving on to our next topic, which is after, okay, we have covered the interview. Now I will ask you, Dr. Shajil, after the interview, what's the step? What's the next step? How long you have to wait for the result? When is the time when the deanery, is there any deanery available? What is the major college and what are the sub colleges? What is the process of then allocation? You allocating, the college is allocating you that you have to do your training in this hospital, that hospital, all about that.
exactly. No, as Dr. Farkhanda mentioned her timeline, so it was pretty much very clear. Like they take time when they process the results, and then after a month or so, they kind of send out these emails to the candidates who are successful, and then they ask for the hubs actually. So for the medicine, the Royal College has 9 hubs actually. So the main one is Dublin. In Dublin, you've got James's Tala, you've got Vincent's, you've got Matter, you've got Bowman Connolly. Then comes the South Hub, the Cork University Hub, and then there's Southeast again, then Limerick, Mayo, Sligo, and Galway as well. So all of these, you have to basically rate it, and it's more about preference. And like when they ask you for preferences for these specific hubs, it's kind of subjective, I would say. Some people won't prefer, like for instance, myself, I didn't prefer Sligo Mayo at all, and because it was up in north, I wasn't ready for the extreme weather and the snow and stuff. And then if you speak to Irish nationals, they are usually eyeing for Dublin hub or the South Cork hub, because these are the major cities of Ireland. So then there was another thing which I want to add here. What people around me, they were of the impression that if you are going to place Dublin at the top and you're not placing Southeast, and somebody places Southeast on the top, they might get placement before yourself. That is absolutely wrong. I've confirmed this twice myself personally with the Royal College, and they clearly said it's all about the ranks. It's all about the ranks.
Yeah.
If you are next in line, you'll be offered. As Dr. Farkhanda said earlier, that Irish nationals would be offered in the first instance. So it is clearly mentioned on the website as well that they prioritize Irish nationals, then the EU nationals, UK nationals, then comes stamp 4, and in the end, it's stamp 1 people. So It's like that. That's a fact. And I would say it's transparent as at
Yeah,
least that they have mentioned back home. Like you have CIP Punjab. They change policy overnight. You know.
exactly.
Yeah.
Definitely.
Yeah. I've been a victim of that policy changes twice. You know.
There has been
So
black and dark
yeah.
games back home.
Yeah.
At least now they're transparent. They tell you what they will do, and they do
Exactly.
actually like that.
Exactly. So
So it's much
whenever,
better.
yeah, whenever people are arguing about, oh no, they are giving preferences to Irish nationals and stuff. So I tell them like back home, it changes everything overnight, like, you know. So, anyways, these are the hubs. Again, it's subjective. As Dr. Farkhanda's family was in Dublin, she wanted that, you know. So it depends. I would say you can eye for the big hubs, the Cork hub, Dublin hub, Galway, and then you have to place them in, like, you have to complete the order anyways, all right? And then wait for the rounds. Again, it depends on the rank. It depends on the competition at that particular, like in this year, it might be different. I've heard they have increased the seats. I'm not sure, but they're increasing seats of BST trainee doctors. So it might be less competitive as compared to the previous years. So again, it depends. So all of these round offers, they depend on these factors. So I would say place the hubs based on the hospitals. Do like even if you spend 5 minutes, 10 minutes searching a hospital. For instance, you're searching James's Hospital. You go through stuff, you know. And then there is one more thing, which is that if you have clarity what you want to do next in HST and your super specialty, then for instance you can search which hospitals are famous for that particular specialty. So
Yeah.
in that way you can place the hub. And I would say like it's you can place the hubs like this, but then again you don't be too optimistic that you'll get the hub straight away again for the same factors which I've mentioned.
Yeah.
And if you're getting any hub, and if you're not getting the desired hub, but you're still getting a post, I would say take it and at least get into the training pathway and get yourself on the lines to become a consultant in the near future. So that would be my advice with regards to hub. And I would like to add one more thing, what Dr. Farkhanda was telling about those undergrad uh, marking criteria, especially for that PSIL ranking certificate. So when I was getting my application bit sorted, so I didn't have the same PSIL ranking certificate. So
Okay.
I discussed across different colleagues, and I found out. Then I requested my college back home to get
Mm.
me that cert. So you know how they work. They take things not that seriously. But I had to ask my elder brother to get in touch with them, and eventually I found that certificate right at the time when my application was about to be submitted. That really helped, and it got me a very good score because of that particular certificate. So now you have the awareness, you still have the time. I think you can get in touch with your HR back home in your medical colleges and ask them. It's not something super complicated. All they need to do is they have to adjust you and rank you in terms of your percentages, and then they give you a rank that whether you're in top 10 of your class, whether you're in top 20, top 30, and based on those ranks, you get those marks. And I think those would be very essential. If you get 16 marks, it's very essential out of 20 or 18 out of 20
Mm.
instead of simply getting 4 or 6.
So, okay, thank you, Dr. Shajil, for sharing all of the information about that. Now, my next question is that what are the portfolio things? Like, do you have, when you are being placed on the placements, now you got your results from the college that you have been selected. This is your hub, and you go and join that college, sorry, the hospital from where
Yeah.
you will be doing your placement. What is the hospital duties, and how do that training like being, what is the difference between a normal NCSD working in a hospital and a trainee, a specialty trainee working in a hospital? What other things that you have to do along with your clinical work?
Right, right, right. I think that's a very good question. So now we've selected the hubs, we've got the results, and luckily we have been placed in one of the hubs. So now we are supposed to start. First thing first, you need to get in touch with your own hub and like with your own hospital, because our CPI won't be getting you the contract and stuff. All right. So you need to get in touch with your hospital. That's very important. The reason is because Royal College would keep on saying that to you, even in the orientation sessions and stuff, that you need to get in touch with your medical manpower and HR in your respective hospitals, get the contract bits sorted because they won't do that. So after placement, this is the first thing you need to do, get in touch with your medical manpower. Then once you are starting your BST, there is a specific e-portfolio known as Kaizen. So you'll get a bit of training on that, and there's supportive documents as well. If you go through it, it will make you understand how does Kaizen work and how do you need to add all of that. And once you get you to your first placement, in every rotation you'll get a mentor. That's one of the consultants who's your training, basically training lead there. So you'll get in touch with the consultant. You'll discuss your training goals. He'll go through all those goals with you. Then you have to add those on the Kaizen app. And after the end of rotation, you'll go through all those goals with your consultant and mentor again, just to see
Okay.
what have you done, what have you achieved in the rotation,
Yeah.
where you can improve, and what are your strengths and what are your weaknesses. It's a one-to-one session, and I think it's a great session for your own for your own growth, like
Mhm.
so that's number two. Then of course, as part of your BST, you're supposed to complete your membership exams by the end of BST, 2 years of BST. I would say start them early, get them sorted early. The reason is because when you're in the second year of BST, and then you have the process of HST on your mind as well. And
Mm,
as a prerequisite of HST, you need to get membership exams sorted as well.
mm,
Previously, it was different. Now they're saying you need to have full MRCP diploma by the time you're starting your HST. So that's another thing which you need to have on your mind when you're starting your BST year one. And along with that, you'll have ample opportunities. You'll have ample opportunities for research, mini researches, audits, any quality improvement projects, grand rounds. Like what you need to do is you need to show yourself that you are really, involved in the journey, because all of this would get you when you'll be applying for your HST, all of this would be counted. Like for instance,
mm,
I applied for a SHO competition, and for different specialities, had one SHO as a volunteer for that particular competition. So I got second position in that, and then again foster competitions as well. You don't, like, even if you don't win, but you're in being involved in that particular competition, that all adds up. So these are the
mm.
things you need to continue to do while you're doing your BST. And of course, in addition to that, you get across different specialities. You go to other specialities, you do the specific clinics, you do specialty cases. So all of this would improve you in a very good way, which would really make a mark, or as a physician, I would say. And it has been a great journey so far for me with regards to that. So I would say these things, your training goals, your Kaizen app, you need to get your Kaizen app sorted.
Okay.
If you're doing any procedure, any diagnostic procedure, even if you're taking good histories in ED, you can add up. You can even get one of your SPRs, registrars, or if the consultant isn't available, that can you please observe me doing this procedure. For instance, you're doing a lumbar puncture, you're doing a
Mm,
tap in ED, or even in the ward setting. You can ask them to observe that, and then you can upload all of that in your Kaizen app. And that is
yeah,
how you are going to maintain your e-portfolio. If you do
perfect.
it every day, if you do it every day, if you do, if even if you do once a week, you'll be good.
And how often do you have supervisions from your consultant? Is it like a continuous supervision sessions also that you record, and then in which one-to-one supervision you discuss with your consultant that this is what you had done, this is what the training, like initially from the start of the placement, you and
Yeah.
your consultant have decided that these are the things that you want to do and at where you are. And what are the reports? Is the college asks for the report, anything like that? So, or tell us
So,
about that as
so
well.
basically, these are two mandatory sessions, which are, which are prerequisite for every rotation. The first one, you get your goal sorted. The next one is your end of rotation, discussion, and then that gets approval
Okay.
on the Kaizen and on your portfolio, and that is
Hmm.
reviewed by the Royal College, because Royal College would conduct once a year evaluation in which they will
Yeah.
they will go through all of that, what you have done, where your e-portfolio is lacking, if there's any
Hmm.
rotation which is still not signed off, all of that. So in order to get your rotation signed off, you need to get your goals straight, you need to work on your goals, and then at the end of the rotation, if your consultant is happy with your work ethic, with your goals, so definitely he would sign off, and all of this gets evaluated once a year by the Royal College. So in that sense, this is how frequent they would do these evaluation. And one more thing now, previously they used to ask for these mandatory BST courses. Now they have kind of changed it to tutorial sessions. So we'll have one tutorial every 3 months. That's a 2 hour tutorial online, again on Zoom, and you'll go through different courses in an online setting where you're given scenarios, you're involved in small rooms with the teams, and then you discuss, then you present, then you do all the problem solving all together as a teamwork, and then of course mini quizzes, and there's a pre-tutorial coursework as well. So this is the pattern we are observing these days with the BST.
Perfect. Thanks very much about that. And do you have to maintain a CPD diary as well, or is the portfolio or the Kaizen that you are maintaining that is equivalent to that?
So, but you can add CPD. It's not a particular diary which we have to maintain. But if you're
Okay.
doing any courses, if you're getting those CPD points, yes, I would say keep evidence of all of that, and you can also add those. But usually, Kaizen, it looks very complex, and to be honest, it has so much stuff, so
Yeah.
much that if you go through it, you'll always end up things which are still missing,
Yeah.
so I would say even if you follow Kaizen religiously and do it in a proper organized manner, your Kaizen is well up to date, they'll be very happy and you're good to go.
Perfect. Thanks very much for all this information.
Not at all.
Very properly informed.
Thank you.
So now I would like to ask Dr. Farkhanda, so that once you are done with BST, and we all of us have talked much about BST, so there is a frequently asked question by a lot of aspirants, by a lot of candidates who are trying to get HST here. So what do you think, how streamlined is the process for getting HST?
So before I say anything else, I'm actually with my kids at the moment, so I apologize in advance if you hear any noises.
It's
So
fine.
what I want to say here is, like, before, like, we were greatly discouraged by everyone around us. They were like, it's impossible for us to get into HST, but that's not the case. Like, now I'm actually seeing a lot of IMGs who are getting into HST, so it's not impossible. That's number one. Number two, like Dr. Sharjeel, he explained very well. You have to prepare for the HSP during your BST. So in every rotation, you need to have a goal that, this is what I need to do. First of all, membership exams. That's the number one thing you need to get over with in your BST. In order to be eligible for HST, you need to have your membership exams. So number one thing. Number two is your research. That's what's going to set you apart from everyone else, because everyone who applies for HST will have BST, will have membership exams. What is it that sets you apart? It's your research. Preparing for the HST during your BST. So in every rotation, you need to have some goal. For example, in one rotation, I want to, finish one audit. In the next one, I want to write a case report. In the next one, I want to present a poster. Like every rotation, you must be doing something. In one rotation, I'm completing my exam. So, every rotation is going to be 3 months. So there is 3 months. So that means there's 4 rotations per year. So in those 4 rotations, you need to have a goal for every rotation. And if you were doing that in your 2 years of BST, you would be prepared enough to apply for HST. So that's basically the main thing. And we're actually running short of time. I had prepared a few slides on this as well, but I think I'll just summarize what I said there. You need to go through the HST, like I said, go through the RCPI website for BST application. You can also do so for HST. There are a few specialties that we're not really aware of. We usually just know what cardiology, neurology, nephrology, all of those. There's also chemical pathology. If you've done BST, you can apply for chemical pathology. And that is actually why I mentioned that is it's very friendly for you can say like a family-friendly career, like we say for GP, so it's one of those things. So if you've done BST and you feel, oh, I cannot do a hospital job anymore, that's so hectic with my family, with my kids, you can go for chemical pathology, which is like a clinical job. It's like a clinic's job. So you are basically just running clinics. There can be bone disorder clinic or diabetes clinic or, but it's just strictly 9 to 5, no weekends, no calls, So that's one thing, and there are
That's good to know. Yeah.
there's other things like occupational health, if you want to go into that, occupational health, again, will have no weekends, no calls, and you can apply for that if you've done BST, Then there's public health as well. Public health is more like an admin job, so you would be at the administrative hem of affairs, trying to manage how things are done administratively. You would not be in a hospital job. So there are other things you can do as well after BST. So if you have BST, you actually have a lot of different options
to do. Yeah.
It's not just a hospital clinical job. You can do other things. There is hematology, there's clinical microbiology, there's all those things as well. So but it's important that it would be good if you know which specialty you would be going for, so that you can do your CV that way.
Okay.
One thing that would really make your HST application strong. For example, like I know that I want to do neurology. I've always tried to do all my researches in neurology. Everything that I do, I try to do it in neurology. So have a directed CV. That's the most important thing you can do. So directed CV, and do something in every rotation, and I'm sure you can get into HST. Like that's my closing remarks. And I would say, I would strongly encourage everyone. I know there are people who are confused whether, oh, I should apply for BSc or not, or I should apply for GP or not. Just go ahead, do it, and hope for the best.
Okay, thank you so much, Dr. Farkhanda, for this good piece of advice.
No problem.
Thank you so much, our lovely guests, for giving us all the information about basic specialty training about medicine. I really thank Dr. Shajil and Dr. Farkhanda, and thanks, Mariam, for co-hosting. We will be giving all the other informations about different specialities, and our podcasts will be coming up through the AIPPS portal. So keep in touch, keep joining, and keep seeing the YouTube channel as well, so that you are updated about the upcoming BSTs that are going to open. The application processes will be open for almost all of these specialties of medicine and surgery, and also GP. And that's all for today. Thanks very much, everybody.
Thank
Take
you so
care.
much.
Thank you, Anam. Thank you, our
Thank you so much.
Thank you. Thanks.